Good afternoon. This is Ephraim here, the CEO and founder of Hutano. So, as a business, healthcare is run very different from many other businesses that we know. All businesses, as we know, will always need some kind of supply and demand, and those forces, as long as they're in balance, a business can sustain itself. Why is healthcare so different? Healthcare is different in that there are quite a number of people between the person that provides the service, that's the healthcare provider, and the person that needs the service. So the supply and demand exists. However, there are so many parties and regulations that stand between those two parties that the cost to the person that does the paying, and the only person that does the paying in healthcare, by the way, is the patient, is significantly high. So if you want to fix the problem, simply say you take out as many of those people between as you possibly can, and all of a sudden you come up with a system that is sustainable for both parties. So I want to talk about how to practically do this because most people think that it's really difficult, and we've heard this so many times that healthcare is very difficult to fix. No, it actually really isn't. There are several medical services right now that people are receiving that are completely cash based and they work just fine. And the reason why they work fine is because the market determines what a service is worth. If a provider charges too much, nobody comes and sees them. If they charge too low, too many people are going to come and see them, and that is not going to be a sustainable environment for them to work. And then, of course, they will have to come up with a price that makes sense so that they're working just enough hours, seeing enough patients, but satisfying every patient's needs so that they can come back and see them on a regular basis. If you give really bad service, nobody will come and see you. However, in healthcare, it's different. You can give really, really bad service, but because your insurance company says that this is the healthcare provider that your company is contracted with, you have to see the same guy that gives you really crappy service. Tell me where else in America there's an exception to the rule that sounds like that. It's horrible. It makes no sense at all. So, how do we take it back? How do patients and healthcare providers take back this thing that annoys both parties so much? Healthcare providers will tell you, we would love to take care of our patients. This is what we went to school for. This is what we got into the field for because we love to take care of patients. But we cannot do it effectively in the 5.2 minutes that the national average for doctors is that we spend with our patients now. And patients are saying exactly the same thing. We want to spend more time with our healthcare providers so that we understand what the plan of care is. But every time they leave the doctor's office, they have more questions than they have answers. That should never be the case. So, how do you make this work? In my practice, I started charging cash several years ago. If you want to come and see me for a physical therapy session, it's $80. That's it. If that works for you, you make an appointment and you will see me for an hour session. How that changes the dynamics is whenever you give me cash or you give me money or you pay me by credit card, I have to reciprocate a value that is worth what you just gave me. And I know that if I see 8 patients in a day or if I see 10 patients in a day, I make $800. If I have one person that's working for me that I'm paying $20 an hour, I can make the calculations and figure out exactly how much money I'm going to make every single day, every single month, and every single year. However, if you are one of those providers who is using a third party to process who comes into your practice, how much you get paid, the equation is a little different. The same work you do on 2 different patients who have exactly the same diagnosis, you get paid 2 different amounts. In of itself makes no sense. But that's just because you have 2 different contracts with 2 different carriers. What is different is that you're going to treat one patient a lot different from another. If a patient comes in with a crappy insurance, you give them relatively crappy service. If they come in with a good insurance, you give them really good service. And it even gets worse than that. If a patient has really good insurance, you figure out ways to get them to come in even more times than they can because that's the patient that's going to be paying for the crappy insurances that you're taking. Something is inherently wrong with this, not to mention morally bankrupt. If you're a healthcare provider and you're a patient and you want to take back this bond of relationship that used to exist back in the day when patients and healthcare providers would trade chickens if that's what it took for them to get good care, you need to come to a point where you realize that primary care, the one type of healthcare that you need on a regular basis to make sure that the engine is fine-tuned, to make sure that there's an oil change on a regular basis, is not so expensive that patients cannot pay out of pocket. At $100, $150, for most people, that's the cost of a haircut. That's the cost of, I don't know, a good meal at a nice restaurant once a year. That's the cost of all the coffee that they drink in a month. It's not a lot of money. But if you're a patient and you are trying to understand the dynamics of how you can change the narrative on how you can get much better care than you are right now, if you change your mentality to thinking about how you can pay your providers cash, I will guarantee you that you will go to the front of the line, you will get really good care, and at the end of it, your provider has no choice but to give you the care that reciprocates the exchange that you just made monetarily. It's pure business. So that's the way you can take it back. If you're a provider, you can tap into this huge market of people who are uninsured. Being uninsured doesn't mean you don't have money, okay? That's a misnomer. And people who are highly underinsured. We're talking about patients who have deductibles in the tens of thousands, 12, 13,000 or whatever it is before a penny of insurance kicks in. You can tap into that business because all those patients are cash paying patients. Why on earth would you bother taking an insurance card from them and running it through the system that has such a high overhead when you could just get paid cash? Anyway, that's my word to you patients and healthcare providers. Let's take what belongs to us. This business of healthcare is really sacredly a contract between a healthcare provider and a patient. Let's keep it that way. Let's make it a stronger bond, and patients can start using their insurance for the big one, the things that really need insurance. If you end up with a heart attack and you need an open heart surgery, or you got a stroke and you end up in the hospital, for crying out loud, go and use your insurance as much as you possibly can. But for day-to-day routine stuff, go and pay cash. You're going to get much better service. Okay, folks, I hope this is helpful. If you have any questions, please let me know. If you have any comments, just put them down below. I will be glad to help you as much as I possibly can. If you're a cash-based provider, please let me know. I would love to put you on Hutano so that you can start connecting with patients that are also looking for providers that charge cash. All right, take care, folks. Bye.